So we're here in Oslo for the GFF replenishment, and I have Githinji, the CEO of AMREF here. We're going to have a bit of chat about what brings them here. So Githinji, so great to see you.
Good to see you too, Roopa.
So you've been one of the most strongest advocates for gender equality and women's leadership. What inspires you? Why investing in women is something that you value?
Because I actually think there are several reasons. Number one is obviously that the strongest people in my life are the women in my life to begin with. It's my mother, it's my daughters, it's my wife. So the strongest people who have brought me up and taken care of me are women. So I have a personal interest in ensuring that actually the support of women are strong, because I've seen them as a pillar for society. And I've seen that through the eyes of my mother as a pillar for our family. So that is really powerful. But I've also seen that as the world moves on, especially for communities like Africa, where I come from, in communities where women are disadvantaged and women are not invested in, the socio-economic development lags behind. But in communities where you invest in women and women are at the forefront, the socio-economic development happens faster. So I think that it's, investing in women is a prerequisite to socio-economic development. And that's why for me it is such a strong thing personally, and also within the organization that I work with, that we invest and purposefully decide, and unashamedly so, to invest in women.
And that's such a strong message there. Personally, your life experience, but in additionally, you're looking at it as a social development case. And when you're here, particularly here in Oslo, there's going to be member states, donors. What's your message to them when it comes to gender equality and particularly investing in the health workforce? 70% of the health workforce are women. The gender dimensions, most health systems are quite gender blind. Is there something more that you see they can do, or ask to them?
I think in this whole discussion, Roopa, and especially the discussion about universal health coverage, which is probably the best philosophical case I have for investing in human capital for the future, is that universality, which is within the universal coverage, is not uniformity. Universality is also, it's about equity as well. That actually you're starting with those people who are most left behind. And in most of the communities that we work in, and because of the balance of power that exists in some of the communities between men and women, the women are always left behind. And because of this, it has an impact on the general health outcomes of the people, of the women and their children, number one. Number two is that if we are going to truly achieve socio-economic development and invest properly in universal coverage, sexual and reproductive health is at the center of it, because we have seen communities. If you look at Africa now, we are saying that as the world population develops and grows, by 2050, half of the growth of the international population will be from Africa. Many cases have shown that women do not have a say. Majority of women don't have a say about their reproductive participation in sexual and reproductive health. And until we give them a say, they will not be able to develop a population that is geared towards a proper socio-economic investment, where we have actually less fertility, and therefore we have families that people can sustain. The power to actually develop a population that we can manage, it's in the hands of women. And therefore we have to invest in women, so that we ensure that we have a population that we can actually invest in for what you may call a meaningful life.
Exactly, and I think really capturing the human capital that's about benefiting all. So investing in women, giving them the ability to make their own decisions over their own bodies, is actually creating stronger societies.
Exactly.
And allowing societies to plan for the growth, etc.
Yes.
And then we're here at the GFF replenishment. So what brings you here? What attracts you to the GFF? GFF really focuses on being a mechanism to really work with countries at the center of its design of financing. It calls itself a catalytic agent. What attracts you to GFF? What opportunities do you see for GFF to actually advance this agenda on gender equality and women's health and SRHR?
Yeah, I think for me, because I'm also sitting as co-chair for HG 2030, and many of the conversations we've been having are about what does post-aid universal healthcare look like? And I think that question is critical for everyone to ask, because we've seen that many countries now, our estimation shows that probably about 58 countries in the world are going to undergo transition in the next 5 to 10 years from aid, from specifically from 58 countries, from direct development assistance to health. Now, most of these countries have to look at what does the future post-aid look like. In the documents I've seen here, many of the countries that are going to transition are obviously in low middle income countries. Okay? I see the GFF as the post-aid model for financing universal health coverage. And the reason I'm interested in the GFF case is because I've seen in many countries where GFF now has brought in its model to finance, specifically with an entry point on women, girls, adolescents, is that the core of the health system provides services, both promotive, preventive, and curative, to women, the girls, and adolescents. So when you invest in GFF approach, which is a health systems approach, everyone benefits, the entire health system benefits. And I see a case here for aligning other international donor agencies towards the GFF model, so that then we have a common health system platform on which everything else operates. Because then we build a health system that's resilient for post-aid. And I think that for me is a real convincing case for the support of GFF.
Right, and that's definitely one of the big themes here. We're hearing already the word alignment. The civil society organizations were talking about how that's important from their perspective, but also from a health systems perspective. And then just, in closing, GFF is having its first replenishment in just 2 days. What message do you have for donors and member states as they come into this replenishment?
That actually GFF is the future model for investing in universal health coverage. We have been talking a lot about moving away from verticalization into a health systems approach. Now, we have had a lot of gains from vertical programs. I mean, no one can take away the successes we've achieved through Gavi, what we've achieved through Global Fund. But now when you look at these models, they are all now discussing with the countries about how to exit from support. And therefore, as they look at exiting, how do the donors start to shift their support towards a health systems approach that supports domestic resource mobilization and also supports domestic resource use? And how do we start to transition our funds, even those that are with the other donors, like Global Fund and Gavi and others? How do we start to transition them to support a global public good mechanism that supports utilization, accountability, especially through civil society, and the power of the people on the ground? How do we try to transition these funds to actually supporting the countries, not only to mobilize, but also to focus on the U in the drum, about the use, about making sure we have proper absorption, about making sure that the people are aware there is visibility of data, and civil society can hold their governments accountable as representatives of the people in the countries. So for me, I think the message to the donors is, let us support the GFF model, and let us start to see how do the other donor agencies coalesce around supporting a health systems approach through the GFF model for the future.
Great, and you said that the post-aid model, that's fantastic. Yes. Well, so great to have you here, and thanks for sitting down with us and having a chat about women's leadership, gender equality, GFF, and health system strengthening for universal health coverage.
Thank you.